As I mentioned before, the actual diagnosis of prostate cancer can be a bit tedious, and that involves something called a biopsy. Once we establish there is cancer, then we need to work out two things. Essentially, for any form of cancer, we need to know what is the grade and what is the stage. The grade essentially describes how aggressive the tumor is. For example, a low-grade tumor probably will progress much longer time and doesn't need such urgent attention. But high-grade tumor is something that may actually spread very quickly and therefore need a very urgent attention. For prostate cancer, we grade it according to something called a Gleason grade. So something that is very low grade is Gleason 1+1, which equals 2, which is the lowest grade of prostate cancer. But if it's Gleason 5+5, which is the highest grade of cancer, this cancer really needs to be attended to as quickly as possible. And that is something that we looked at as far as grade is concerned. But don't be confused with something called staging. Staging essentially look at how extensive the tumor has spread. For example, if it's stage 1, it's confined in the organ itself. If it's stage 2, it's nearly about to come out. If it's stage 3, it probably involved with the lymph nodes. And if it's stage 4, then it would have spread to the bones. So how do we do that? In fact, for the bone analysis, we just do something called a bone scan. An injection of isotopes that will actually highlight what area of the bone is involved, and that will make sure that the bone is not involved. And a CT scan or a PET scan can also be done in order to make sure whether there's an active lymph node that may signify the stage 3. So for anybody who is in the organ confined disease, it's completely curable. Next week, we're going to talk about how to eradicate prostate cancer. So how do we do that? Then you need to stay tuned for next week's Putting Dr. G on the Spot.